meeting for December 15th, 2020, 10:30 a.m. We will start off with approval of the minutes for November 10th.
Make a motion to approve.
I second it.
All in favor?
Aye.
Aye. Okay, new business, introduction to the DFC program coordinator, Francesca Golili.
Hi, everyone. I'm Francesca. I'm the new Impact Norwood program coordinator. I work really closely with Aubrey, which has been great. I started in the health department in mid-October, so I'm starting to get acclimated and get my feet wet, which is great. I'm in the process of wrapping up my graduate degree at Boston University, where I'm earning a master's in public health, and I'm excited to put some of those skills to use in the program.
Oh, welcome.
Great.
Nice. Okay. Moving right along, old business, flu vaccine update.
If you'd like, I can provide that for you. We have approximately 130 doses left. We've been running clinics every Tuesday from 1 to 3 here at Town Hall. You can call Jen to make the appointment, and I can give you that number, or we even take walk-ins on that. But I'll give you Jen's number anyway, and it is 781-384-9197, and you can call and make an appointment. Anyone over the age of 14 and over. We've been also doing some other little clinics out in the community. There was a clinic uptown for the uptown businesses or anybody uptown walking around at the Charles River running. And so we had a small clinic up there. They hosted it, and that was very nice of them. And then this Friday, actually, we'll host another clinic up at the high school, Norwood High School, from 3 to 5. To capture anybody, any of the kids or faculty, anyone, families, entire families can come, anyone who hasn't had the vaccine yet, because as you know, it's a requirement by December 31st that students need to have a flu vaccine, whether they are fully remote or in school hybrid. So that's the update with flu vaccine.
Can I ask a question to Stace?
Sure. Go ahead.
Stace, how are we going to enforce that, honey, by December 31st? Are we in charge of how do we check the record? What do we,
The school. So what it is, and they actually had a very high submitting their documentation. So just like with any vaccine, whether it's MMR or any other required vaccine, they treat it the same. So when they get the vaccine, they get a little certificate or some documentation, and they submit that to the school nurses, and they put it in their system, their tracking system at the high school, or I mean at the school.
So that needs to be done by December 31st.
Yes.
And if that is not done, the next possible scenario to that is, do we contact the students? Do we contact the family?
No, the schools do. It's a school. It's a Massachusetts Department of Public Health, but it is enforced by the schools, just like all their vaccines. They'll reach out to the parents and give them opportunity to get it done. They'll send a letter. They'll call them. They'll work with the families. But yes, it is a requirement.
Do you know if there's a lot of outliers or just a few, or?
From what I hear, it's been people have been doing it. So they've been going either to their private physician or the pharmacies, or Jill Driscoll, the nurse leader, has had numerous clinics at the different schools. So she really gave them so many opportunities to get this, to try to make it easier for the families. But no, I think they're in good shape.
Great.
Okay. All right. Moving right along. COVID-19 update.
So this is obviously the topic that consumes our department, and this will overlap a lot with my director's report. Like I said, this is pretty much all we do at this point. Numbers have really risen in the last 2 weeks. So we look at the 2-week reports to follow the state report that comes out every Thursday. So the report that will come out this Thursday will be encompassing of November 29th to December 12th. So those represent the test dates. So obviously the tests take a few days to come in, so those numbers are still coming in. And what they do is they run the report Wednesday morning and then publish it, do all the analysis and publish the town by town report on Thursday evening. So we also run it on Wednesday morning, so we have a good idea, plus or minus a few cases, of the numbers that'll come. At this point, already we have, within that 2-week period, over 260 cases, which, just as a point of reference, last week's report, in the previous 2-week period, we had 167. So drastic increase. And that number will climb a few more by tomorrow morning, when we will pull down the numbers and actually produce a report for the following day. So, I mean, that's a rate in the 60s. So big increase in the last 2 weeks.
Do you think that this is Thanksgiving starting to show?
For sure. And we've actually, anecdotally had a few cases that were linked to Thanksgiving gatherings, for sure. It's linked to Thanksgiving. It's linked to the second surge. It's like we keep saying, there's no one thing we can really point to. It's just a lot of spread in a lot of different places, unfortunately. We don't have access.
Go ahead.
Okay, go ahead.
Tony.
No, I was just going to say, you can imagine what it's going to be like after Christmas. The couple of weeks after Christmas.
Yeah, when there is so much community spread, it's really hard to slow that down, because you think about exponentially how it just increases so quickly. The more cases you have, the faster it increases. So it's sort of fueling its own fire. We don't have access to the percent positive data. Last week we were just above 5%, which moved north into the red category. I do expect us to be red again, but I don't know how much our percent positive will increase. We only get access to that data usually Wednesday evening, hopefully.
How many did you see this week again?
So far in the report that will be this week, so far we have 262. I expect that number to rise a few more by the time we run the report tomorrow morning.
Mm-hmm.
So we're already 100 over what we were the previous week's report.
Wow.
So dramatic.
So,
Thank you.
how many, I know the percentage is difficult, but how many of the percentage of this 260 are children in the school system? Just for the sake of the townspeople. I'm sorry?
Yep, I wouldn't say a large percent.
Okay.
It's usually between 50 to 20%, 15 to 20%. And that's about the percent that they are of the population. So if we have community cases, we'll have school age cases. But what's important is they're not getting it from school. They're getting it from usually households, like we've talked about before. Most of our clusters are household clusters. Now, obviously, where's the household getting it? Where's that index, that initial case getting it from? But most of the students are exposed in the home, or there's been some sporting event clusters, their own workplaces. So that's where we're seeing most of the exposure for students. So we have not seen at this point school transmission. So because of the hybrid model and the fact that, for the most part, most students are only in 2 days a week, the chances of them being in school during their infectious period is drastically reduced. So while we do see school age cases, we do see many instances where they're not in school during their infectious period. And if they are, because of the safety standards followed at the school, very little to any close contacts identified in school.
That's great. That's good news, really.
And just with the number of
good
cases,
Go ahead, Scott.
Just with the number of cases, that is where a lot of our energy is focused, is on the school cases. We have the Community Tracing Collaborative, which is the state sort of overflow contact tracing system. They are also unfortunately overwhelmed, but at this point, a lot of our town cases do go to the CTC just because of our capacity. We're very thankful. We have 2 public health nurses, and we have increased our capacity. But still, at these type of numbers, no health department can handle these type of numbers. And we really want to focus on keeping those schools safe and open as long as we can by really concentrating on cases that affect the schools.
So I don't know if this is the right question to ask at this time, but so many children or parents in the community, it's related to COVID, that have had contact with COVID patients need to get a rapid test. Now, I've been told by several people, adults, that they're hard to find a quick rapid test. Is there any site that you could put out there? I mean, I'm sure you've heard, where do I go? Where do I go? Where do I go? I mean, parents are looking frantically for that quick rapid test to put their son back in school, to have them go back to sports, to go back to church, to go back to whatever it takes. And these places are in Cambridge and in the city, and there are lines and lines. Is there any place that is, I'm sorry, go ahead. Yes.
Not recommending the rapid tests for these kids. I think they're recommending that they get the PCR. Am I correct?
That is actually a very recent change. Now the antigen test, so there've been more and more research coming out about the antigen test, and it is now included as two things. There has been changes to quarantine, which allow the quarantine to be, which allows you to, the quarantine is still 14 days. It's a very complicated change, and I might have Stacey explain it. I wouldn't say quarantine's been reduced. You still need to monitor yourself for the 14 days, but you can get a test on certain day numbers, day 5 or later, and be released on day 8. And Stacey, do you mind if I ask you to summarize that a little better?
Like Sigal said, we don't want to give people that sense of, gee, at day 8, I can get out. You still need to monitor your symptoms for 14 days. So let's call it a soft quarantine. So you have to promise, when the public health nurse calls you, you have to promise to monitor yourself for 14 days for symptoms. And in any time during that 14 days, you get any type of symptom that is a COVID-like symptom, whether it's nasal congestion with a headache, body aches, loss of taste and smell. So any of those symptoms at all, you pop back into quarantine. So let me just start with that. So it's still the 14 days. And I think a lot of people are losing sight of that. So there are times, you remember me saying my mantra before, there's no get out of jail free card. You can never get out of quarantine. Well, the CDC has changed that through some surveillance. And now that we have a lot more cases, we've been doing this for a lot longer, that we can see that for the majority of people will convert. So if they're exposed, they will convert a lot sooner than the 14 days. And so in other words, to get people to comply, it's a lot easier. It's a lot easier, I guess, pill to swallow to tell people that you have to stay out of work for, let's say, 10 days or 7 or 8 days, 7 days, is a lot easier than to put someone out for 14 days. And again, it's based on research. They look at people and their conversion back to their conversion once exposed to be a case. So with that caveat, if you're tested on day 5 after your exposure, so you were exposed on, you're exposed on day 1, 5 days later, you have the opportunity to test out of quarantine. And again, you're still in it, but you can go back to work and go back to your activities. Day 5, that's the earliest day you can get it done. So if you go and get a test on day 3 after exposure, that doesn't count. You really need to it has to be day 5 or later. If you get that test on day 5 and it comes back negative and you have absolutely no symptoms, you can do your 7 days of quarantine, and that means on day 8 you're released. So it's the full 7 days. If you get that negative test, either day 5, day 6, or day 7, you get released on day 8. And they changed it. They used to say only PCR. They have changed it to now antigen or PCR. Antigens are a lot easier to find and they're rapid. They're a lot faster. The Norwood Hospital trailer is fabulous about getting results back within really around 2 days. Whereas if you get a PCR at some of these other places, it can be 7 days, 8 days. But Norwood's been great. But antigen's just another option for people. If you do not want to get a test, if you're like, nah, I don't really want to go get a test, you get to quarantine for 10 days. Again, absolutely no symptoms. You can't have any symptoms. And you still have to monitor for the full 14 days, but you promise to quarantine for the 10 days, and then on the 11th day, you're released. So you're released on 8 days. Just to recap, you're released on the 8th day if you get an antigen or PCR that's negative and you have no symptoms, or you're released on the 11th day, no test, no symptoms. Any symptoms at all, you can't do either those two options. You can't do the 7 and 10-day options. You have to do the full 14. Even if you test out negative, you still have to, because you have symptoms that are, consistent with COVID, the respiratory headache, whatever it is, because you want to be that careful. I hope.
But basically, this is like the honor system. I mean, this is like we're trusting the whole world to be honorable and say the right thing, that they're judging themselves. Some people children, young adults don't have supervision. They're judging themselves to make that decision and then resurface into the community.
Right. And a lot of times when we talk to people, especially nurses, we can kind of tell when someone has nasal congestion. I say it all the time. How you feeling? You sound a little nasally. And then people go, yeah, I have a little nasal congestion, a little sore throat. So they do. And I have to say, most people want to do the right thing. Of course, there's always that outlier, but I want to say the majority of people are they don't want to spread this to other people.
So that test that this person takes to get out of quarantine safely, where do those results? I understand they're looking online and they find them and they say negative. Does that result go to you, or
Yes.
do they keep that with them and give it to somebody?
Those results go to us. So if they live in Norwood, all test results are submitted into the database that we're always talking about, that MAVEN database. And so we get the results. So we can look them up. If someone says I have a negative test, we look it up. There is a little bit of delay because sometimes the lab has to report it to the state. The state has to review it, put it on MAVEN. And a lot of times what we've been doing is, Katie can attest to this too. We'll have them send us. They'll take a little snapshot with their phone and send it to us. So at least we have that.
Okay, so my next question, that certainly explains it fully, and I'm sure the rest of the board gets that. But my question is, where does one go for this quick, okay, and I'm going to use the word, sports. Where do I go to put me back into sports that same day? I mean, they're traveling all over the state to get these quick tests.
It's the testing. The system is overwhelmed, Carolyn. Everybody wants these tests. Remember, everybody wants to test out so they can get on with their lives. So unfortunately, you can go to Howard Hospital does the PCR, so that's a couple of days. But these rapids, they're at the testing site. You have to call around. And you can go on the website. What is it? Get Tested, Sigal? I forget the name of the site.
Yep, there's right as a link on our website, but it's mass.gov/gettested. It's right at the top of the health department's coronavirus webpage.
Okay, thank you all. You knew I was going to ask all these questions.
No, it's just some legwork. You might want to call ahead and find out which test do you have? How long will it take for me to get the results? Some places have long lines.
Some places don't even answer their phone. Some places aren't even answering their phone. They're so busy.
Yeah.
Okay, I appreciate that. That sounds absolutely great. Thank you, Stace.
You're welcome.
If I may, I just want to go back to the whole changes with quarantine. So understand the science and the reasoning behind it. And like Stacey said, we hope you get better compliance with people following their quarantine if it is shorter. And that's one of the goals. But it took her about 10, 15 minutes to explain it. So understanding the complexity of it and how much harder that makes us able to explain it to cases and people in contacts that need to quarantine. So it's really on the ground. Can everybody hear me? Yep. On the ground, it really made our jobs a lot harder. I'm just going to pull it up real quick if the board will entertain me here. Just to show you what the new chart looks like. So Stacey did a great job of explaining it, and this is sort of the chart we call it the 7, 10, 14-day rule now, that there's actually 3 options for quarantine based on your symptoms and, your testing and, all those caveats that Stacey went over. So what was a very simple, you're in quarantine for 14 days no matter what, became this complex picture. So just understanding that it really made our job much harder on the ground, but understanding the science and the need for it, and that we hope we get better compliance with quarantine.
Could you send that to us, Sigal?
Yeah, for sure.
I would love that format also, please. Thank you.
Is that all? Is that also on the website, Sigal?
I have links to it from the state website. So what I usually do is, because things change all the time, I like to put links to the state website that they keep up to date with the latest guidance. So there's definitely links on our website to this. But, you know, every case is going to have its little idiosyncrasies. And so, you know, I would recommend you follow what the person that put you in quarantine, whatever they said, because every case is different. But this is definitely a guideline you can use to understand quarantine.
And each person we put in quarantine is sent that, so they can read it and really understand it, because it's very difficult when you're on the phone with someone and you're nervous, you might be stressed about it, and then so we send them that so they can really read it and digest it, and also show it to anyone else who has questions.
I did just want to, so we have a great partnership with the testing trailer at Norwood Hospital, so they do provide us with their numbers. So since the beginning of November, they've tested over 1,700 individuals, so that's a great number. So to have that resource in our community was definitely advantageous. Just a few more things, and again, a lot of this is going to overlap with my director's report. So. I just want to add, we are still working with school committee.
Moving along.
Can nobody hear me? Can you hear me?
Yeah, you have kind of like a pause, a Sigal, you know, before you
speak.
speak.
A little delayed?
Yeah, you have a delay.
Oh, I'm sorry. That's frustrating. I'll try to be quiet then. Let someone else go.
No.
Stacy, I don't have nasal congestion. I coughed and I said to Stacy, I don't have nasal congestion.
So you say.
So moving along, we'll go to the public health nurse report. Katie?
Hi, everybody.
Hi, Katie.
So we just passed to National Weeks, National Influenza Vaccination Week and National Hand Washing Week, both very prevalent. So as you guys can imagine, most of what me and Nick are doing all day, if not all of what we're doing all day, is contact tracing. And we already shared the numbers, but we're seeing about 20 cases a day right now. So that's what we're spending our time on. And besides that, we're still doing the blood pressure clinics. We just did one on the 9th, and the next one will be on the 23rd at the senior center. And the same rules follow, where they're allowing a maximum of 6 residents in the area at a time. They have them sit down before we take the blood pressure to make sure, you know, we get a good number. Still holding our flu clinics on Tuesdays 1 to 3 over here. The past 2 weeks we got a good number, and we're hoping to continue. And then the last thing that I wanted to bring up is just the COVID fatigue we're seeing. Everybody's hearing the same things over and over, and it's been since March now. So when we're calling people, we're finding, you know, a lot of times we understand people are tired of hearing, you know, what we have to say. But I just want to remind everybody that it's important to be forthcoming with us. Tell us all the information. Don't leave anything out. Even if, you know, somebody has something coming up, or you want to protect somebody in your family, it's important that we know everybody that you live with, everybody that you came in contact with. And it's also important you keep on following all the recommendations, especially keeping distance. And that's it.
Katie, thank you for what you're doing.
No
It's
problem.
overwhelming, and I hear wonderful things about what you and Nick are doing from the community.
Oh, good.
They want to know who you both are. And I tell them they're new additives to the health department, and you're making a storm very calm for a lot of people.
That's good. Thanks for saying that.
You're welcome.
Okay, moving along. Impact Norwood Program Director Report. Aubrey?
Yes, good morning. So I will try and keep this short. As I'm sure everybody is aware, the whole pandemic is also causing quite a bit of mental health problems to surface. So the focus of the coalition lately has been trying to promote positive mental health and help youth and adults in the community find resources and positive coping skills. So I actually recorded a couple podcasts last week. One was with John Mettleman. He is a therapist, and he did a presentation for us towards the beginning of the pandemic to help parents and guardians kind of manage their children's anxiety and stress and identify the signs that their kiddos might be experiencing a mental health crisis and what to do. So that should be airing shortly. We also brought in a mental health empowerment speaker, Ivy Watts, to both the high school and the middle school. We had over 200 students in attendance on the high school side, and we had over 300 students in attendance on the middle school side. And there was more interest from some middle school students to do more work with Ivy. So we are going to bring Ivy back in to do some more deep diving with our middle school students. She's a fantastic speaker, really encouraging and empowering. So we're excited to be able to bring her in as a resource for our youth. Impact Norwood has also absorbed the Minds Matter Coalition. I'm not sure if you remember that. Segal started that maybe 2 years ago, I think, to promote the interface mental health referral service. But given that Segal has a lot of things on her plate, and it overlaps so well with the work that Impact Norwood is doing, we've absorbed Minds Matter. We're going to be implementing a mental health survey in the community just to find out where people are at, if there are barriers to accessing mental health services. So Francesca developed that for us, and we're very thankful for that. Our group is meeting on Friday. We're going to go over it, and then it's going to be going out to the community. So we want as many people to take it, so be on the lookout for that. And I'm actually going to turn it over to Francesca now, who's going to talk a little bit about the work that has been happening on the Youth Coalition.
Thanks, Aubrey. So the Youth Coalition is continuing to meet. There are currently 20 students actively attending and enrolled in the program, 9 of which are in the middle school, and 11 of which are in the high school. And so in terms of logistics, the middle school students meet weekly on Tuesdays at 3 via Zoom. And the Norwood High School students meet at 3 p.m. on Fridays via Zoom. And Aubrey and I are also planning to start hosting a joint meeting. So both schools will meet together on Fridays monthly, and just to build and bridge the gap between both schools so the students can get to know one another and really work more cohesively, given most of them are remote. So many of the students are juniors and seniors this year, and so we're working really hard on recruitment efforts to bring new students into the program. And the goal there is to have each grade represented in the program, which would be great, and we're well on our way there. And the students have been working on a social norms campaign that aims to shift the perception around youth substance use and to highlight the productive and positive ways they spend their time. And so they've worked to create a hashtag to help capture people's attention. It's called We Are the Norm. And so Aubrey and I are hoping to help launch that campaign in March. So be on the lookout for that.
Sounds like we've got some good things going on here. That's great.
Yeah, it's a great group. So I'm glad to be a part of it.
Good.
That sounds like you're keeping busy with the idea that there's both the high school and the middle school involved, because those middle schoolers will be high schoolers, so hopefully they can continue the work that they did in the middle school into the high school. So
right, yeah, I feel like it helps to build sustainability of the program to have students across all age groups also.
So that's it for Impact Norwood. Thank you.
right along.
Oh, can't hear you, Kathy. No, can't hear you.
Motion detected at the
Go ahead,
front steps.
Aubrey. Are you all set?
Yep, we're all set. Thank you.
Can you hear me now?
Can hear you now.
Thank you.
Excuse me.
Okay. So we're moving to the sanitarian report.
Okay, Kathy, it broke up. You want to do the new food establishment first?
Correct.
No, can't hear you.
I don't know why not.
Okay.
What is that under? That's under sanitation.
New
Okay.
food establishment. Okay. Oh, is Angelo here?
I'm here. Are we ready?
Yes.
All right. So the new
Yeah.
Oh,
Yeah.
okay. So the first two there, the Rob Peters Entertainment, that's DJ Dogs. The hot dog trailer that's stationed at Furlongs for the moment on Fridays. So he was permitted several weeks ago. Then we have Crust Pepper. So they've changed ownership as well. So they've been officially transferred to new ownership. So he's been operating for about 2 weeks now. The pending locations you see there are obviously still pending. I know Cedar Market is a holdup with their beer and wine license. So as soon as they get that resolved, they will be inspected for a change of ownership. If the board has any questions on the rest of the establishments here, just let me know.
Okay, who is getting the food and wine? I mean, yeah.
Beer and wine, it's Cedar Market.
Oh, Cedar Market. Okay. That didn't come over here. All right. Okay. All right. Now, what happens with the mobile truck? Does it move from the candy store there? Does it move from there?
Yes, it's a hitch trailer. It hooks up onto his vehicle. So it's not it's a trailer. It's not actually a mobile food truck. It's a food trailer that gets hitched on at the back of his vehicle.
Oh, okay. That's different. Okay.
That's not unusual. It's actually pretty common. So, but
for furlongs?
yes. So he apparently either rents some space or time to be in the parking
Is that
lot
what
selling hot dogs.
Okay, I got it now. They rented some time from furlongs. I was trying to catch the connection between furlongs and the truck. Okay.
It's in the
All
parking
right.
lot. Yes, right at the parking lot on Fridays.
Okay.
Hours, yeah.
Oh, okay. Okay. Okay.
We have a question, Angelo, about crushed peppers. Are
Sure.
they changing ownership or just management?
That's a change of ownership.
Okay.
It's a new one. So Patrick will no longer be the owner.
Oh, good. Okay. Who is taking over?
I forget the gentleman's name. He has owned restaurants before, so he's pretty familiar with the regulations of the food code. So hopefully he'll be in town for a while and be successful. So I'm pretty confident.
Okay, now did he work for him at all, Patrick, before?
He did not.
Oh, good. Okay. All right.
Also,
okay. So when
saw-
is he taking? Go ahead, Kathy.
I saw on your report that they haven't gone before the selectmen yet, so are they permitted to open? Or do they have to wait until they get approval?
That was pending, correct. Yeah, to
Okay.
meet with the selectmen first, do the Tuesday night meeting, and then officially operate as a new owner.
Okay.
He was informed of that during the inspection. Yeah, and I think he did call the office while I was there to schedule an appointment to meet with the selectmen.
Okay.
Okay.
Now, when it says down here, Rojo's is remodeling, does that mean, what are they remodeling? Just the store?
It's the side of, it's hard to explain without showing you a picture of it, but there's a floor plan where on the side where the car wash is, they're gonna expand it into a retail area. So it'd be like a retail, like a gas station that sells hot dogs and sandwiches and beverages. That's probably not gonna take place for quite some time though, probably into early next year. Early to
Okay,
mid.
is that where the Speed Shack and all that stuff is?
Wrong road though.
No, that's on Providence Highway where the Irving gas station is, where Burger King is.
Yes.
Yeah,
Past Burger King, correct.
yeah, no, I'm asking about the Rojos. On where is this going? Is it going next to the, behind the gas station where there's a building? In that building, there used to be a dry cleaners and a Speed Shack and stuff like that, all in that building right there. Is that where that's going?
It's gonna be correct. It's gonna be extended there and then to the side as well.
Okay, all right, okay, I got it. Good. Cedar Market changing ownership?
Correct.
Who's that going to?
It's a gentleman who owns several retail shops, I believe in Rhode Island, who is actually taking over this location.
Okay,
And again, he's just waiting for the beer and wine license to go through before he actually officially takes over the location.
okay, all right. Good, all right, that works. Okay, I'm all set with the new food.
Angela, does that mean that if they're approved for their beer and wine, they'll sell beer and wine in the market?
Correct.
Okay.
They're currently doing that. Eli, the owner, they've been doing that for years.
Okay.
The owner doesn't want to take over the business until that's official. And that's when once that becomes official, he'll call me for an inspection to officially take over the location.
Okay.
Yeah.
Okay. Okay, we on to the inspection report?
Yep, go ahead.
All right. Talk to me about the 7 hens. Are they going to get bigger or be able to hold the cold foods, or what are they doing?
Yeah, there's no plans for them to expand the operation. So I don't know if you've heard, but they were cutting their own fruit in the walk-in cooler and displaying it out in the retail cooler,
Right.
which obviously the location is not permitted to do so.
Uh-huh.
Nor do they have the equipment or certified staff on site to do something like that. So they did remove the food from display. He did voluntarily discard the product that they have prepared on site for display.
Mhm.
So they're not doing that currently. They have no plans that I've heard of expanding the operation to do something like that there. As far as the 2 violations you see there, they were corrected after speaking with the person in charge there.
Uh-huh.
So,
Okay.
Do we need to consider to keep them on the list just to make sure that they don't go back to selling the food products?
I can do a follow-up inspection for the next meeting, sure.
Yeah, I would like that. I would like to just make sure that they're just not, that they didn't just do what you asked, but then knowing it won't be in soon, they'll go back to their old ways. So
Sure.
I'd like to just do a follow-up on that.
Okay. On page 3, the new golden abacus.
Yes, so the reinspection is scheduled for later this afternoon. I will be going there for a reinspection to check up on the items that you see on this report here. So there will be a follow-up to the reinspection during the next board meeting.
Okay, could I suggest we put them on and, keep track of their grease trap disposal logs and things like that? At one point, we had a problem, but, it hasn't been the last couple of years, but I just slow back
Sure.
to see them. Are you there, Angelo?
I am here. You were breaking up, but
Hello?
I got you though. Sure.
Oh, okay. Okay. Limey's Pub, did you go down for a few, Stacy, to figure out what was going on, or? No, it just said that they contacted you to discuss the complaint. I figured maybe you might go down and have a nice cold one while you were talking about the complaint and see what was going on. No? Oh, okay. Yeah, I think you're muted. I can't hear you.
I think it means the person in charge, Stacy at Limey's Pub, not our Stacy.
Yeah, not me.
I'm thinking you're going around checking all the pubs, Stacy.
No, if you would like me to, Joan, I can.
Hey, that works. And if you need a helper, I'll walk along with you. No problem. Okay.
So yeah, Angela's our boots on the ground as far as taking complaints, COVID complaints related to businesses. So that's what this is.
Oh, okay. And here I thought we had a new category coming up. Okay, not a problem. Okay, have we had any problems before we go on with anybody serving after 9:30 and stuff?
Not that I'm aware of, no.
Okay. All right, moving right along on page 4, Mina's Cafe.
Yes, so there was a reinspection conducted on the 20th of November to go back at the items. They did correct the buffet area so that a staff member is designated to serve customers when they walk in. They also put tables in front of the buffet so customers cannot approach the buffet. They can actually tell the staff member what they want on their plate to be served to them. Yeah. So.
Oh, all right. I thought that they weren't supposed to have buffets at all. From the government.
They can't be self-service buffets.
But they can still have a buffet.
Correct. The staff member can plate up the plate for the customer and give it to the customer. Correct.
Okay.
The customer cannot serve themselves at the buffet.
All right. I understand now. I just assumed that it meant no buffets, period, but it doesn't. Okay. As long as you have a staff member. Okay.
Yep. There's no self-service. That's all. Yeah.
Okay. Moving right along, page 5. IHOP.
So at IHOP, the 2 violations you see there were corrected while I was there.
Okay. At one point, we had a problem with them. You think they're sliding back, or you think that was just a single incident?
I think there's a new person in charge there. He was able to answer my questions about the operation, so I'm pretty confident that he knows what he's doing, obviously. So, but yeah, I don't think it requires a follow-up.
Okay.
Doing a good job there. There were no COVID-related issues there. It's pretty, the facility is being maintained. Staff is properly trained, so I don't see any major issues for me to go back and do a follow-up.
Okay. On the same page, McDonald's with the hair restraints. Not that I go there that often, but it does seem to be a problem. Like there's an awful lot of times I go there that there are not hair restraints. Is that something that you made sure that they understood that they were supposed to have hair restraints?
Yeah, it was one staff member. This was the location on the highway. There was one there was one staff member there that the manager took her aside, explained to her the proper procedure and how to properly straighten her hair, and she did correct it while I was there.
Okay.
I don't see it as a widespread problem in the location at all, to be honest.
Okay, because at one point there were 2 or 3 of the people that had hair like that weren't being restrained. Okay. But there's only one, you say now?
Yeah, there was only one staff member there.
Okay.
Correct.
Okay.
Can I ask you one question?
Sure.
Is this the time of year that the anti-choke certificates expire? It seems like all the schools, I know they're very busy with the COVID, but hate the fact that that all of their anti-choke people have expired. Is that something that it's just this time of year and they need to be updated?
So what they do is all the food service staff at the schools get certified at the same time.
Okay.
So every 2 years they expire at the same time. So Eli, they scheduled a choke saver class for tomorrow, December 16th, to have all the food service staff there recertified in anti-choke procedures.
Okay. I kind of figured that because, I mean, we usually have no problems with the schools. They're really pretty good about maintaining cleanliness and everything else. So I was a little bit surprised to see that they all had expired anti-choke. So,
And I think the ongoing pandemic has pushed a lot of stuff.
I just,
Sure.
that's a thing, especially with kids. You know, they can choke on anything. So I'm glad that they have, hopefully they won't get snowed out tomorrow, but that's good to know. Thank you.
You're welcome.
Angelo, page 6, the Kyusebo Latino Food Market. It's on Washington Street. They should know better than the raw chicken stored on the shelf above containers of fruit and veggies. Is this a new owner?
It is not a new owner. Actually, there was quite an improvement at this inspection from the previous one. So I've noticed a major difference when it comes to their critical violations, their food holding. This issue was corrected on site while I was there. But overall, I think it was a pretty good inspection.
Okay, I noticed that they're supposed to have debris removed in the area decluttered, and you gave them 30 days. Are you planning on going back after 30 days?
I plan on following up on that issue, correct, yes. And
oh,
that's
good. All right, so we'll put them on the list?
That's more of a landlord issue, but yes, I can put them on the list, sure.
Okay, yeah, just to keep an eye on them to make sure things are all right. Okay. And let's see, page 7. And that Rob Peters you already talked about, so I think that should be all set.
Correct.
Mm-hmm. And crushed peppers. When is he going to start taking over?
I'll have to follow up and see if he's met with the selectman's office before he officially takes over the operation of the business. So I can give him a quick call today and find out what the status of that is.
Okay. Okay. I'd be interested to hear that. Let's see. Page 8. Taibu.
Yes. So Taibu, the reinspection was conducted on the 30th. Violations from the routine inspection were corrected while I was there. They did receive, let's see. They did receive a written warning for the ice machine, for the soda machines. So they were advised that the next violation for the same issue will result in a fine to them.
Okay. I noticed they all also have a staff breaks in the room. Isn't that a no-no now that you know? Well,
yeah, the food code says that the staff members will have to take their meal breaks in a designated area, not in the main kitchen, not on the cook line, not on the prep tables. So I did see that while I was there. That was corrected on the 30th. They are now instructed to take their meal breaks in the dining area, and they do not do indoor dining. So there's no excuse for them to not be out there and have their meal breaks out in the dining area.
Okay, so they are having their breaks out in the dining area, or they're not?
Moving forward, they are, correct. Yes.
They are. Okay. Okay. And the last one is Wendy's.
Yes, I'd actually like to put Wendy's on the follow-up list. I do want to go back.
Oh, good, because, okay, yeah. Go ahead.
There was a new person in charge assigned to the location, and he did not have his certificates posted, and there was just some stuff there that needs to be tidied up, so I will be doing a follow-up for the next meeting.
Yeah, that was pretty bad when I stopped there one night, and I, you cannot go in, but just looking around from the drive-up, I decided to leave. It was pretty bad, just looking in the window. So, okay. All right, so I'm glad they're on the list. Make a long story short. Okay. And I think that's it for me.
No, that's it for me. Thank you, Joni.
Okay.
Thank you, Angelo. I'm all set.
And thank you, Angelo.
Welcome.
Thanks, Ann.
Pleasure.
Oh, this is, oh, great, go ahead. I just wanted to mention that I just understand, Carolyn, that Paul Angelo, I just got a notice that Paul Angelo is closing his eat-in restaurant, but he is having some takeout. So
Yes,
that
all kinds of takeouts and very small functions that are allowed under the law of the government. He's just
Right.
closing indoor dining at this time and working on the other aspects of the restaurant.
That's a sad sign. It really and truly is a sad sign. He is one of the staples of Norwood, but I'm glad to see he's still opening up for bereavement. You don't call them parties, bereavement.
Yeah,
What do you call them?
Bereavement luncheon. But they have to be a certain amount. I mean, they can't be more than 24, 25 people. It was a very difficult decision for him and Martha to make, but they made it together, and they'll go forth, and hopefully we will see them open their doors in 2021.
Oh, I certainly hope so. Like I said, it's a very sad time, you know, for the town of Norwood, really. But, you know, I'm glad to see he's still taking takeout orders. How do they do now, Carolyn? They just call in and
then you just call in and talk to whoever answers the phone, and they'll tell you, come on down in 20 minutes, or do you want curbside pickup? And it's done that way.
Oh, that's wonderful. Was it still 76? What is that?
690323.
Okay, all right. Yeah, I thought that was the number. I wasn't really sure. Okay. What was it again? 769-0323?
Yes, there's another number, but it's left you can Google
Okay.
it. It's another number. That's just the number I call.
Okay, that's great. All right. Thank you, Carolyn. I appreciate
Thanks,
that.
Jody. Yeah.
Okay.
Okay, moving along, back to Segal for the director's report.
Just real quick, I also wanted to just draw attention to the board. Angelo has also included a report about all the COVID complaints and the follow-up that he conducts on that. If the board has any questions, but that's like everything with COVID, it's also consumed us with our inspections.
Right.
Okay. I'm looking for that.
Yeah. And those are complaint-based inspections. So people call us up and lodge a complaint. We follow up on whatever we can.
Okay.
So, Segal, do we follow up on, you know, when we get a report at 9:30 that somebody's still in a restaurant, or and you get the complaint, do we follow that along? The police don't go down there and talk to them.
We work in partnership with the police department.
I'm sorry?
Sorry, am I still delayed?
Yeah.
I mean, the police is not going down there and issuing them anything, are they? I mean, they're in dire straits as it is. When does the police come involved?
Well, we're spread pretty thin ourselves, and we do work with public safety, and they are partners with enforcement. So they might, if there is something off hours, weekends, nights, they can help us by going down and taking a look and following up on a complaint. A lot of times, to be honest, people have video these days. So, you know, if we do get a complaint of service after hours, it can, you know, people can review their videotapes and see if that was actually going on. We do get complaints. Some are substantiated, some aren't. Some are true, some aren't. But we try to follow up on all of them.
Okay.
Wow. Hard times for people that do, you know, to proceed with it. But we handled Thanksgiving, you know, very well. Everybody complied, all the restaurants, all the stores, everybody. What I saw through the town was very quiet and everybody complied with what there was. So I think most of the people are understanding the crisis of COVID-19.
Sure.
Is there anybody think that these places are closing at 9:30, Segal?
Motion detected at the front steps.
Yes, they are. We have found that everybody that we've followed up with has been compliant with the closing restrictions.
Okay, so we're waiting for a complaint before we go around, because I've heard of one place that is consistently open after 9:30.
Breaking up zone.
So they can be open after 9:30. They can no longer serve after 9:30. So if somebody is sitting and finishing their meal, that's okay. But these are all complaint-based inspections. So we get a complaint from the public and we follow up on it.
What I heard was the bartender was saying, how many beers do you want at, a certain time? And so, they could order 3 beers and sit there until the 3 beers were gone. That was the type of,
they definitely have to be closed by 10. So they need to stop service at 9:30, but they have to be closed by 10 for sure. And we can talk if there's a specific location that we need to follow up with. We can talk about that offline.
Okay. I just didn't know if we had complaints about it, but, okay, I will speak to you later. Okay. Okay. What else I got?
So looking at my report, I covered some of it, but just a few more things I want to go over. The state has launched a Get Back Mask campaign, and as a public awareness campaign about the way we get back to what we love about Massachusetts and our lives is by following all the safety standards, wearing our mask, keeping a distance, socially distant, and getting tested, staying home if you're sick, all those things that we've been saying since March, that we need to continue to be vigilant. And like Katie talked about, I know what people are getting pandemic fatigue, and especially now as we're in the second surge, a lot of people are tired of it, but we need to continue to be vigilant so we can get back to our lives and what we all love to do, and being together and being social beings like we're supposed to be. I talked a lot about working with the schools. We have sort of, we really structured our steps in response to lay down the guidelines on how we would pivot a classroom or a school or even the district to remote. So kind of timely that we sort of pin that down a little better. We constantly stress that we need to be able to react what's on the ground, and you guys heard me say it many times, things are constantly changing. So we need to have a fluid system that can adapt easily. But we were able to sort of lay some groundwork of what would cause a pivot to remote. We talked a lot about in Angela's report. You can see the complaints and the follow-up that we do as far as the COVID orders, the governor's orders. In light of the surge and what's going on, the governor's actually talking at noon today. Like most times, we don't know what he's going to say, but I think we need to think about our operations on the town side also. And as we do enter this high surge, the second surge, that we might be thinking about our services in the town and, contemplating no decisions have been made yet, but thinking about we might need to roll back services and start going remote again also for everybody's safety. So that's going to be probably on the table again soon. Then just want to end with some light at the end of the tunnel. Vaccine. This was yesterday. I think the first Massachusetts residents got their official vaccines that weren't part of the trial. Remember, there were thousands of people that did get the vaccine as part of the trial, so it has been very well tested. The state has rolled out, and if I could pull up another image, you know me and my images, I'm a very visual person. The state has rolled out their vaccine plan. It's a 3-phased plan. And within the first phase, these are actually listed in priority order. So right now we are in that first bullet point with clinical and non-clinical healthcare workers doing direct in COVID-facing care. So those acute care hospitals are really where they get the first Pfizer vaccine. And we're also seeing some long-term care facilities also getting vaccine at this time. We will move down that category, hopefully in the next couple months. At this point, we don't know when local health will be involved in the vaccination effort. We do think we will at some point, definitely in phase 3, but maybe even sooner. We have drilled and planned for many years to vaccinate our first responder partners. So we hope that we will have an opportunity to put those plans into work. And especially with the Moderna vaccine, the Pfizer vaccine, because of its storage limitations in the sub-zero or ultra-cold temperatures, does present problems when you're talking about administering the vaccine in a community. But the Moderna vaccine is freezer temperatures, which we have the capacity to handle here. We have vaccine freezers and have the ability to do that. So hopefully this week, if the Moderna vaccine also gets emergency use authorization, that will start to roll out the end of this week, beginning of next week. And the trucks will start rolling on that vaccine too. And then we'll see additional doses come into the state. At this point, the state will get about 300,000 doses by the end of the month, they're estimating, the combination of both the Pfizer and Moderna vaccine. And that will continue with the phase 1 vaccinations probably through February, March. We will hopefully enter into phase 2, where that will expand the population a lot as far as we can get the vaccine, as the vaccine availability increases. You'll see sort of the essential workers category in the second bullet of phase 2, which includes teachers, a lot of public works and public health officials, sanitation, food, agriculture, all those industries that really allow our economy to keep moving are in phase 2. And then when we get, hopefully in the spring and through the summer, we'll be working on phase 3 to get the rest of the population vaccinated. So the light at the end of the tunnel.
Okay. Do you think the Board of Health will be directly involved in giving those shots?
We don't have any clear guidance from the state at this point. We hope at some point we will be administering, I think definitely in phase 3, because that will sort of be, everybody will be vaccinating at that point. But we have been planning really since 9/11 and the anthrax scare. We have been charged in local health across the country to plan for mass dispensing and prophylactics, whether it be antibiotics, for anthrax or vaccination in a pandemic. So we have been planning for that for close to 20 years. So I'd like to put those plans into action. And I think at some point we will, and to some scale, but it's still yet to be seen. There's so much unknown about the vaccine as far as distribution.
Good.
How long in between, oh, go ahead. How long in between each vaccination? It's a 2-dose vaccination, Sigal. What is the time between the first one and the second one?
Yep, both the Pfizer and Moderna vaccine require 2 doses, about 28 days. I think they vary a little in the number of days apart, but about 28 days apart. To get that really effective. Have you seen anything?
Right. Have you seen anything like an ID card or anything that is going to implement that? You got your first shot and you're ready for your second, and you could take it somewhere and make sure that they have that second shot available to you. Procedurally, I'm a little confused on, how you get the second shot. I mean, everybody's very excited about the first, as all of us. But that second shot, sometimes, where do you go? Is it readily going to be available on that 28th day if you have to have it on that 28th day?
We'll continue to see an increase in doses coming into the state. So the availability will only increase as time goes on. So people will have access to that second dose. But, we do have to be cautious that adds extra time. So when we're talking about trying to get the full population up to that 90% effective of the vaccine effectiveness, it's going to take longer time because it is 2 doses.
So you cannot have first dose Moderna, second dose Pfizer?
No. At least I'm pretty sure, right, Stacey, that you would have to get the same vaccine. Yes.
Yeah,
even though they are very similar vaccines.
Stick with the same formulation, yes.
Right.
Okay, and there's no different in the first inoculation stage or the second from Pfizer and Moderna? They both contain the same thing, the first and the second dose? Are they exactly the same compound?
Correct. No, they're a little bit different because they're different companies, so tweaked a little bit different on their formulation.
No, I know Pfizer's different from Moderna, but if I got Moderna's first and I got Moderna's second, are they both the same contents? Is there anything different in the second one that the first one didn't have?
No. It's the same formulation. Yes. So
formula. Okay, that's
the same. You just need that
formula. That's what I wanted to know.
Doses to elicit that immune response that you need. And the two formulations. The first one has to be ultra cold, like Sigal said, and then also you have to reconstitute it, which means you have to mix it together. So it's a little more cumbersome than the Moderna. Is like our.
You listen to me, Shaggy. You mix the vial.
So with the Pfizer, yes. With the Pfizer, you mix it. It's like MMR. It comes in 2 different vials. So you reconstitute it. So it probably comes dried, frozen.
Oh, okay. Then you put the liquid into it. Yeah.
And you put the liquid into it, and that's what we're hearing. And then the other one is more standard in a vial, and you draw it out. And they also come. Pfizer comes in a huge batch, almost 1,000 dose batch, like 996. Where Moderna is a much smaller. I think it comes in packages of 100. So it's just a little easier for the locals to handle that.
So with the Pfizer being readily and available, the hospitals can handle this deep freeze to keep it active. But local small places don't have that availability for that type of deep freeze.
Well, you can. It's just that your time limit. So it'll come in dry ice, and there's a time allotment to it. So you'll get a batch. it has to go in this special container with dry ice. You can add dry ice to it, but you have to watch it a lot more. It takes more expertise with that, just because in the other is not a little longer shelf life. It's just a little easier to handle. So if you're sending it all out to the communities, you just want to make sure everyone can handle it. So I think that's why it's going to the larger hospitals and healthcare centers that have these ultra cold freezes and the capability of really handling this vaccine. The Pfizer.
Yeah, I understand that the dentists are petitioning to give injections. I mean, did you hear that or read that?
No, dentists have been approved. Those are doctors. Paramedics can. There are a lot of people that can give the vaccine. Dentists definitely were approved.
So they have to be able to store it though, to give it.
I more see them helping out in a community.
Okay.
More than them divvying it out in all these small batches all over the place. Unless you're looking somewhere like maybe a dental school or something, but I'm just making that up right now. So that isn't in writing. So
thank you.
You're welcome.
Okay.
Can I ask you a question?
Do you think
about phase
about-
2 here? Hold on.
Yeah, I just want.
Can I just
Okay. Sure.
Can I ask a question about the phase 2? Do we think this is going to be, because I'm getting a lot of questions from people who have multiple comorbidities. Is it going to be doctor driven? Do you think the doctors will be letting them know when they can get the vaccine if they have comorbidities?
Correct. Yeah, that they will probably get, if cases like that, will probably get it from their primary care or their physician.
Okay, so it's safe to say
She'll come back.
Hi.
Kathleen, you're stuck. We can't hear you.
All right, Kathy, we lost you. You were about to say it's safe to say, and then we lost you.
yeah, I'm back on. I lost my,
Okay.
so it'll be the physician's offices that are most likely letting them know, correct?
Yes, and they can get vaccinated there. They could get vaccinated at pharmacies. So it's going to be sort of all hands on deck,
Okay.
and we hope to be in that mix.
Okay. Thank you.
One of the questions I had, Sigal, was, did they think they're going to give the school kids the injections at school?
That's a great question, actually. So this vaccine, if you remind me the number, is it 14 or 16? The trials were not on kids, so it's not pediatric approved. There is an lower age limit.
Mm-hmm.
I thought it was 16.
16?
I thought it was 16.
Yeah.
Yep, and they won't be till probably that phase 3. So we have some time. They are continuing to do more research about the vaccine and additional trials. There are also pregnant women and children who are not represented in the trials, so we have more information to come. And more vaccines to come too. These are just the first 2 out of the gate. There are more vaccines in the pipeline to come out.
Okay, but like I said, the questions I got, will it be administered to school kids? But if you have to be 16, then it would just be certain high school kids. It would be available to at school.
Mm-hmm.
Okay.
Eventually it will be, though, as we continue through phase 3, where we do want everybody vaccinated, and assuming that it gets pediatric approval.
Okay.
That will eventually happen.
Okay. All right. Thank you.
Any other questions? Sigal?
You fall for the information for us and for the community. It's a lot and it's overwhelming, but this certainly helps understanding the vaccine, the process, and who gets it and who doesn't, and how we're going to curtail this. Thanks, Sigal and Stacy.
Thank you. Okay, to the board's agenda. Carolyn, do you have anything?
Oh, God, don't you think I've talked enough? No, I'm done. Thank you.
Joan?
Listen, I just want to tell everybody to happy holidays.
Yes.
Over and have a wonderful Christmas, and everybody celebrates New Year's, so have a wonderful New Year's too. That's it.
Okay, and
Healthy,
basically,
happy New Year.
that's my message too. Merry Christmas, Happy Hanukkah, Sagal, and anyone else that might celebrate Hanukkah. Stay safe, and hopefully we'll see you all in 2021, and this will start to get better. Let's keep our fingers crossed that everybody's looking forward to a happier, healthier 2021. So,
And maybe we can get together and, just get together.
Happy, healthy holidays to everybody. Be safe.
Thank you.
we need to make
Happy
another.
birthday to my mother. My mother's
Yeah.
birthday.
Oh, happy birthday to Momo.
Yeah, it's tomorrow, right?
No, today.
Stace?
Oh,
It's
happy,
today. Oh, happy birthday to your mother, and she can wish me happy birthday tomorrow. Okay.
Happy birthday, Joni.
You beat me to it, Joan. I was going to say, and another birthday tomorrow.
Yeah. Okay, but I'm not celebrating them, so I'm still the same age. Okay.
do we have another meeting set up? I don't think we set one up for January.
I think we were hoping to be able to get in, touch in person, but I guess not.
Yeah, I don't-
Unfortunately not. Probably not till the summer, till we're all vaccinated. And you
Yeah.
know what, as we pull out our calendars, I do want to mention the one other thing about the vaccine. We will still, unfortunately, as people start to get vaccinated, we will still need to follow all the safety standards. We'll still need to wear our face coverings. We don't know at this point whether it just stops you from becoming symptomatic or actually getting the virus. So we don't know if you can still transmit it. So unfortunately, we need to keep all those safety precautions, keep wearing our masks, socially distance until we have more information. And like I said,
Oh,
more
can I
research
just
is
ask
happening.
No, you already
One
had
more
your
question. No, one more question. Stacy Segal, if the mutation of COVID, if I got it, God forbid, and gave it to my husband, is it a lesser form or does it stay the same strength? I was wondering about the mutation of the COVID. Does it lessen from person to person?
No.
No, not at all.
No, it doesn't. No.
Nope.
So if I gave it to two people, they won't get it in a lesser form.
No.
Just thought.
Nice try, Carolyn, though. Nice try.
It's good though. Good
Okay,
deal.
thanks. Okay, let's go to January.
okay.
All right, I made my motion, Kathy.
We have to make a date.
Oh, all right. I don't have a calendar. Who's got a
Okay.
calendar?
I have a calendar. How about the 19th?
Sounds like a
That's
plan.
great.
The 19th, okay?
Yeah.
Great. If we
10:30.
need anything we can. Yep.
10:30. And how about February? Should we do February as well?
Yeah, I don't think anybody's going away on vacation.
So we would have either the 16th or the 23rd.
16th sounds good, because if we go too far into the end of the month, then we mess up the following month.
That's
Okay.
February vacation. I don't know if that affects anyone. That's school February vacation. If they're having a vacation, I'm not sure.
Oh,
Out there for anybody who's watching grandchildren or anything.
okay.
I'm not at this time. It changes daily, but let's book that day then.
The
That's
16th?
okay.
Oh, yeah.
Yeah.
We can always, yeah.
We can always change it if we need to, but we'll
Yeah.
put it tentatively for that.
Well, now, if I'm babysitting, we can tie him up and I could still do the meeting from wherever I am.
Hey, that works. Lock them in the box.
Oh. So you
Okay, I appreciate it.
have that. Okay, Joan, you can make your motion.
I would like to make a motion to adjourn on this wonderful sunny day with the
And
snow.
I second it. Thank you, everybody, for your help.
All in favor?
Aye?
Yeah.
Aye.
Aye.
Aye.